In our practice, we have completed the suicide protocol, which I have run across the Pennsylvania Psychology Association to some degree to get some feedback about it. And what they did, they gave me a lot of feedback of how to conduct a suicide protocol, safety protocol. And it's not just a contract for safety. When somebody comes out of the hospital, we have them bring a person in to the session with them. Now, is this HIPAA violation? It's continuity of care. And somebody has to be a safety person. They're not going to know everything about every session. They're not going to know everything about this person's therapy. But they agree to come in for the first or second session after discharge from hospital. And they agree to be a safety protocol person. Now, there's several questions on the protocol, but they have to answer yes to at least one of the top 3 questions. Questions are, would you be willing to sit with this person for a 24-hour period if they call you as a safety protocol person? Well, maybe, maybe not. Second question is, would you be willing to wait with this person while the EMTs or the ambulance comes to help them? Would you be willing to wait? Well, maybe, maybe not. Maybe so. And the third question is, would you be willing to take this person to the emergency room for an evaluation if they claim they're suicidal? You have to say yes to one of the top 3 questions. If you say no to all 3, you're not really a great suicide protocol candidate. And so the person comes in, first session or second session, and I received advice from Pennsylvania Psychology Association to try to make this session a warm session. Try to make it about the client, not about filling out paperwork, not about filling out a safety plan, so that it's just about protecting the practice. It's about protecting the person and the good of the person and the welfare of the person. So the idea would be that, yes, maybe 40, 45 minutes of the whole first session with the safety protocol person in the room is to reestablish feelings of relationship. Is the person feeling frustrated? Are they alienated? Are they disenfranchised? These things happen before suicide happens, attempt happens. And so the first hour perhaps is all about helping the person become more associated with the very same person that they're listing as a suicide protocol person. And so it's a little bit different than able to contract for safety, because you're actually involving another human being. And so the idea is that if they feel they're going to commit suicide or going to hurt themselves, they might call us or they might text us, but they're going to text their or call their suicide protocol person to come over and be with them. And we have done this successfully several times since we've instituted a suicide protocol program.